Hello and welcome to Lyra. In this video we're going to look at vertigo and dizziness. What are the differences between those two conditions? What are the causes, the symptoms, and some natural ways in which you can take care of them. Before we do that, as always, if you enjoyed this type of content, please support our work by liking, sharing and subscribing. Also hit the notification button so you don't miss out on the content that appears here. I would also very much appreciate if you would consider supporting us directly by becoming a Patreon or by making a small donation via the PayPal link. Patreon link also in the description box below. For the price of a cup of coffee, for $5, you can support the work that we're doing for a whole month. Your support is much appreciated, and without further ado, let's learn more about vertigo and dizziness and how to take care of those conditions. So dizziness is an altered sense of spatial orientation, a distortion of where we are within a space, and like your balance just feels off. That's this kind of feeling that your balance is off somehow. Vertigo, on the other hand, is truly the sensation of self-movement or the movement of your surroundings. It's a spinning sensation. True vertigo must be therefore distinguished also from faintness and lightheadedness and other forms of dizziness. Vertigo results invariably from a disturbance of the vestibular equilibrium apparatus. And the balancing mechanism is the vestibular system with its 3 semicircular canals, and it contains the mobile crystals of calcium carbonate, lymphatic fluid, and vestibular nuclei, and connections, the eyes, and the sensory nerve of the muscles, the joints and tendons. And this may be therefore also affected by any of a large variety of disorders. The first one is the autogenic, originating from the ear due to laryngitis. Laryngitis is a bacterial or viral infection of the eardrum, and laryngitis is a form of acute otitis media and is caused by a variety of viruses, such as, for example, herpes zoster and other types of bacteria. The bacteria Streptococcus pneumoniae and Mycoplasma are very common causes. Other causes are otitis media, middle ear tumors, labyrinthitis, petrositis, and petrositis refers to an infection of the temporal bone. This is the bone in the skull that surrounds the ear. And this infection goes deep into the inner ear, and it is sometimes associated with otitis media. Also, otosclerosis. This is the abnormal growth of bone of the middle ear, and this bone prevents structures within the ear from working properly. Obstruction of the external auditory canal or the Eustachian tube. Also Meniere's syndrome, which is a disorder of the inner ear that causes severe dizziness, ringing in the ears also, or tinnitus, hearing loss, and a feeling of fullness or congestion in the ear as well. Also toxicity due to excessive alcohol and drug consumption, such as salicylates, streptomycin, opiates, nicotine, caffeine, and other various sedatives can be a cause. Environmental factors can be a cause, such as motion sickness, a sunstroke, or an abrupt change in atmospheric pressure. Ocular impairments, such as glaucoma and ocular imbalance. Cerebrovascular issues, such as hypertension, transient ischemic attacks, especially in the vertebro-basilar distribution. Also pastoral hypotension, overactive carotid sinus reflex, and cardiac failure. Another reason could be the blood dyscrasia and There are medical conditions, hematologic disorders that may affect the cellular or plasma components of the blood, the bone marrow or the lymph tissue, anemia, leukemia, and polycythemia. Infectious diseases can be another cause, such as influenza, diphtheria, typhoid fever, streptococcus, epidemic encephalitis, syphilis, measles, mumps, and herpes zoster. We also have neoplastic causes such as tumors of the cerebrum, the cerebellum, the cerebellopontine angle, the eighth nerve, and the labyrinth, and other miscellaneous causes such as hemorrhages, psychogenic disorders, temporal lobe seizures, and multiple sclerosis. So here this gives you maybe an easier to understand overview. Vertigo is the sensation of movement, a horizontal spinning sensation, and is associated with nausea, vomiting, sweating, and generally feeling unwell. The causes, we've discussed many of them, the peripheral causes, BPPV, Meniere's disease, and acute vestibular neuronitis. Central causes are posterior circulation infarctions, tumors, multiple sclerosis, or vestibular migraine. And in the slides here on the right, you can see the pathophysiology of all of it. So there is a mismatch of sensory inputs between vision and perception, and this affects the vestibular system. And we see here also how the vestibular system is built and how it also connects, of course, to your brain through the vestibular nerve. You have the semicircular canals that we've already mentioned and the endolymph. Another possible cause for vertigo is a biological conflict, so it's psychosomatic. The vestibular system is the region of the inner ear where the three semicircular canals join with the cochlea, as we've seen, and it is the part of the ear that regulates the sensation of balance and motion. The cochlear branch of the vestibulocochlear nerve is responsible for hearing. And the vestibular organ originates from the ectoderm and is therefore controlled from the postsensory cortex. The vestibular organ in the right ear is controlled from the left side of the cortex, and the vestibular organ in the left ear is controlled from the right cortical hemisphere. Hence, there is a crossover correlation from the brain to the organ. Important to note is also that the vestibular organ shares the control relays with the cochlea, therefore many times vertigo is associated with hearing impairments as well as tinnitus. According to its function, the biological conflicts or the psychogenic trigger linked to the vestibular organ is a balance conflict, more precisely a so-called falling conflict. Any fall, whether it is accidental, whether it happened while you were doing sports at work, or you fell down the stairs, you slipped on a wet or icy surface, or you fell from a ladder, this all could trigger such a conflict. Certain professions, such as builders, construction workers, roofers, but also infants and the elderly are therefore more at risk. People also with ALS or MS who have difficulties balancing often live in fear of falling, and the same holds true for epileptics. The conflict also relates to seeing someone else fall or collapse, so witnessing having, for example, somebody having a stroke or a heart attack, or hearing that a loved one fell or dropped dead. In a transposed sense, the conflict could be experienced as a fall from grace or as feeling dumb, let's say after a separation, or when you lose a good job, or when you have a separation from society and friends, or in a competition, for example. One can feel that he or she has lost his or her balance, the direction in life, feels confused, scared, and panicked. All these psycho-emotional conflicts have a so-called active conflict active phase and a so-called healing phase. During the conflict active phase, there is a functional loss of the vestibular branch of the vestibulocochlear nerve, resulting in a loss of balance. That's what we call vertigo. Whether the tendency is to fall to the right or left is determined by a person's handedness and whether the conflict is mother, child, or partner related. Hence, if a right-handed person has a mother-related falling conflict, there is a tendency to fall or spin to the left, that is towards the mother, with the relay on the right side of the cortex. If the conflict is partner-related, the tendency is to fall or spin to the right, that is towards the partner, with the relay on the left side of the cortex. For left-handers, it is of course reverse. If the conflict concerns oneself, the falling or spinning always tends to be to the side which relates to the original conflict. For example, if the event was a fall to the left, a specific vertigo symptom is also a sensation of spinning or falling to the left. The brain relays of the inner ear are located right underneath the control centers of the coronary arteries and coronary veins, which are assigned to a male territorial loss conflict and a female sexual conflict, respectively. Hence, the falling conflict involving the vestibular organ can also have a territorial or sexual aspect, so feeling dropped by a partner. And the same applies to the cochlea. Whether the conflict is experienced in a male or female fashion is determined also by a person's gender, laterality, and hormone status. And during the healing phase of the vertigo, it diminishes. Recurring vertigo attacks are triggered by setting on a track that was established when the original falling conflict occurred. Alcohol, for example, could be such a track. And if the falling conflicts affect the vestibular organ of both ears, this causes a vertigo constellation. The symptoms are wide-based and unsteady stance and gait with reeling or lurching movements. The medical term for this condition is ataxia or Friedreich's ataxia. The physical incoordination and clumsiness is not a result of muscle weakness, but it's due to the unbalanced equilibrium caused by the double vertigo. Since infants and the elderly are more likely to suffer falling conflicts, ataxia develops more often in childhood and in later life. Meniere's disease, also known as primary endolymphatic hydrops, is, according to conventional medicine, an inner ear disorder that affects balance and hearing. Actually, the condition is a conflict combination of a falling conflict involving the vestibular organ and a hearing conflict involving the cochlea, if you look at it from a psycho-emotional point of view. Next, let's look at how traditional Chinese medicine sees this whole condition and what they recommend that you do about it. The main symptoms are giddiness and blurring vision with a subjective impression of movement in space or of objects moving around oneself, or with a tendency to lose equilibrium. In light cases, all symptoms disappear with closed eyes. However, in serious cases, the continuous whirling sensation and of things turning makes a person feel like falling, accompanied with nausea, vomiting, sweating, or faintness. Pathology in Eastern medicine is as follows. The real causative factors of vertigo and dizziness are categorized in the following way. First, the hyperactive liver, the yang, is flaming upwards and attacks the head and brain, known in Western medicine as hepatic encephalopathy, due to the yang excessive body type or to prolonged strong unhealthy emotions such as anger and stress. The liver qi energy converts gradually into liver fire, and in this case it is a destructive energy due to a high liver toxicity, usually generated by toxic emotions. The excessive yang of the liver also converts into internal wind, called yin. Combined, they attack the head, creating the vertigo. And to buffer the fire equal to heat, an internal wind is created from the antagonist yin coming from the kidneys, which are in charge for the water metabolism. and kidney yin loses its power to nourish the liver, causing liver fire and wind attacking the brain. The deficiency of energy chi and blood, so the stasis, is that toxic, stressful emotions, deficient liver chi, chronic diseases, major hemorrhages, they all cause a liver chi deficiency. Thereby it loses its function of sending pure yang to the head, and the deficiency of blood loses its ability to nourish the head. The deficiency of kidney essence, well, due to the body type or to the aging process or excessive sexual activities, the kidney essence, the source of bone marrow, is diminishing, and brain is the sea of bone marrow. The kidney essence deficiency causes the brain to starve due to the insufficient blood nourishment, so vertigo may develop. Usually this speaks for dysfunctions of the spleen and the stomach. The turbid phlegm obstructs the spleen and the stomach, which is supposed to separate the pure from the impure and ascend the pure yang to nourish the head. Also, phlegm is easy to combine with other pathogenic factors such as wind, damp, fire, and generates the pathogenic factors that cause dizziness and vertigo. Now let's move on to the therapies that TCM recommends. When the vertigo stems from an excessive liver yang type, the symptoms are the following. It shows up or becomes worse when you feel stronger anger, resentment, frustration, and when all these emotions occur also with a flushed face, restlessness also accompanies them, insomnia, a bitter taste in your mouth, a red tongue with yellow coating, wiry pulse, marked emotional changes and behaviors, irritability, a feeling of chi rushing upward, red eyes, headaches, and when it all lasts the whole day, when you have also tinnitus, palpitations, insomnia, hot flushes, anorexia, feeling of distension and oppression below the heart, abdominal bloating, muscle spasms in the shoulders, neck and back, as well as dizziness and vertigo. Therapy is a Gambier formula, which sedates the excessive liver yang, clears the internal heat and wind, and this is a very good formula to treat vertigo or dizziness due to the excessive liver yang, also the internal heat and wind. Liver excess easily attacks the spleen according to the relationship of the 5 elements in TCM, so this formula has also ginseng to strengthen the function of the spleen, which makes this a perfect remedy to treat a liver problem without worrying about the functions of the spleen and stomach. This formula also clears heat from the liver channel, descends liver yang, extinguishes the liver wind, transforms phlegm, strengthens the spleen, and enriches the fluids. Indications for this formula are vertigo, of course, dizziness, hypertension, headaches, migraines, cerebral infarction, arteriosclerosis, palpitations, strokes, deafness, Alzheimer's, dementia, Meniere syndrome, neurosis, chronic nephritis, tinnitus, hyperthyroidism, and aphasia. When the vertigo stems from an excessive liver yang with a kidney yin deficiency, TCM says the following. You treat the excessive liver yang due to the kidney yin deficiency. So it is especially good to take at the late stage of the vertigo, after the symptoms become mild or weaker, some formulas which nourish and tonify the liver and the kidneys. Symptoms, again, vertigo and dizziness, most of the vision and eyes impairments, also deafness and joints, bones and tendon conditions. And the therapy here is lithium, chrysanthemum and Rehmannia 6 formula, which all nourish and tonify the liver and the kidneys. They also brighten the eyes and enrich the yin, increase phagocytosis, increase detoxification, lymphatic activity, also immune system activity, and they also protect against platelet damage by radiation, and they protect the liver from attacks of chemicals. And as you can see here, apart from vertigo and dizziness, there are many other indications that can be treated with this formula in TCM. The other option is vertigo caused by an excessive liver yang with damp and heat. Symptoms here are hypochondriac pain, headaches, dizziness, red sore eyes, hearing loss, a swelling in the ears, a bitter taste in the mouth, irritability, difficulties urinating and painful urination with a heat sensation in the urethra, swollen and itchy genitalia, yellow foul-smelling leukorrhea, short menstrual cycle with reddish purple blood, ear discharges, yellow urine, chest pain, constipations, turbid urine, dry throat, hematuria, pain in the armpits, and sweating in the groin. Here the therapy that the TCM recommends is a so-called gentian decoction. It's a strong formula for excessive liver fire combined with a damp factor. Except for vertigo of the strong liver fire type, it is often used for cystitis, urethritis, vaginitis, leukorrhea, endometritis, genital pruritus, gonorrhea, acute cholecystitis, herpes, acute pyelitis, and acute prostatitis. And again, as you can see, the wide range of indications from migraines, headaches, eczemas, gastrointestinal problems, gallstones, etc., etc. If the vertigo stems from kidney essence deficiency, which is due to the kidney essence of this body type and also aging process or excessive sexual activities, the TCM recommends the following approach. Kidney essence is the source of bone marrow in TCM, and brain is the sea of marrow. The kidney essence, the yin deficiency, will cause the brain to be insufficiently nourished, and this causes dizziness or vertigo. So they say that you need to strengthen the kidney essence by tonifying the kidney yin or yang. Symptoms here are low back, knee and painful legs and weak, foot pain, lightheadedness, vertigo, tinnitus and diminished hearing. Also chronic dry and sore throat, toothaches, wasting and thirsting, dizziness, muscular weakness, so the so-called Wei syndrome, dry skin, deafness, steaming bones, tidal fevers, loose teeth, dripping urine, thirst, dry tongue, numbness and weakness at the waist and knees, heel pain, a dry mouth, blurred vision, urinary incontinence, and spontaneous and nocturnal emissions. The therapy here is the so-called Remania 6 decoction to strengthen the kidney essence, the yin, by tonifying the kidney yin and the blood. And again, you can see, apart from vertigo and dizziness, it has many other fields of application in TCM. The vertigo or dizziness can also come from the so-called turbid phlegm type. The turbid phlegm obstructs the spleen and stomach, which is supposed to separate the pure from the impure and ascend the pure yang to nourish the head. The dysfunction of the spleen and stomach lead to disorders of ascending of pure yang and descending of turbid yin. Also, the phlegm is easy to combine with other pathogenic factors such as wind, damp, fire and qi to cause dizziness and vertigo. Symptoms here: heavy head, suffocating and fullness of chest, poor appetite, nausea, vomiting, somnolence, white and greasy tongue coating, slippery and deep pulse, dizziness, of course, and vertigo, possibly severe form of vertigo, headaches that may be recurrent, stifling sensation in the chest, nausea, vomiting, copious sputum, spots before the eyes, heaviness of the head, lockjaw, sinus congestion, cold feet, fatigue, abdominal distension, weakness of the hands and feet, maybe also an edema, sudden loss of consciousness, excess salivation, and compulsive sleeping after eating. And the therapy is Pinellia, atractylodes, and gastrodia decoction to eliminate the damp phlegm by using dry and pungent herbs. It promotes also the functions of the spleen and stomach, strengthens the spleen, dispels dampness, transfers phlegm, soothes the liver, and extinguishes wind. And you can see again a very wide range of indications, from Meniere's disease, hypertension, to tubercular meningitis, all the way to tinnitus, otitis, deafness, etc., etc. You also have some homeopathic remedies at your disposal to take care of your vertigo and dizziness. Belladonna. It's a top remedy for acute vertigo when the person shows the tendency to fall to the left side or backward, and when the vertigo can also be accompanied by an acute headache and the body may also experience excessive heat. Gelsemium for vertigo with extreme dizziness with dim vision and heavy eyelids. China for vertigo with loss of blood or fluids due to diarrhea, anemia, or surgery or an injury. Coccolus indicus for vertigo with nausea, vomiting during traveling, or when you have cervical spondylosis. Conium for vertigo in elderly people, or for BPPV when the vertigo arises upon turning head sideways. Bryonia alba and conium for BPPV, which by the way stands for benign paroxysmal positional vertigo. When this BPPV appears on the movement of the head or changing the position of the head, also when the vertigo due to the BPPV is short-lived, and it varies from a few seconds to minutes. Belladonna, gelsemium, and phosphoricum acid for vertigo resulting from cervical spondylosis. Kino, podium, chininum sulfate, and phosphorus for vertigo in Meniere's disease, a condition in which hearing loss, sounds or noises in the ear, so that tinnitus and vertigo occur. Silicea, pulsatilla, and cocculus indicus for vertigo with ear troubles, ear infection with discharge and pus. Cocculus indicus and petroleum when you have a vertigo with nausea and vomiting. And cyclamine and gelsemium for vertigo with visual disturbances in various forms like double vision, dim vision, loss of vision, or light flashes before the eyes. Let's sum it up then and see what we've learned. As we've seen, vertigo is a very complex condition with many possible symptoms related to losing a balance, having the sensation of spinning to the left or to the right, depending on the original psychogenic or biological conflict which triggered the vertigo. As we have seen, also the vestibular system is the region of the inner ear where the three so-called semicircular canals join with the cochlea, and it is the part of the ear that regulates the sensation of balance and motion. The vestibular organ originates from the ectoderm and is therefore controlled from the postsensory cortex, and the biological conflict, the trigger, the psychogenic trigger linked to the vestibular organ is a balance conflict, more precisely a loss of balance, meaning a falling conflict. Any fall, as we've discussed, whether it is accidental, whether it happened at work or in your household, can trigger such a conflict. And certain professions, of course, such as builders, construction workers or roofers, but also infants and the elderly are more at risk. Whether the tendency is to fall to the right or to the left is determined by the person's handedness and whether the conflict is a mother-child or partner-related conflict. The brain relays of the inner ear are located right underneath the control centers of the coronary arteries and coronary veins, which are assigned to a male territorial loss conflict and a female sexual conflict respectively. Hence, the falling conflict involving the vestibular organ can also have a territorial or a sexual aspect when you feel dropped by your partner, for example. And whether the conflict is experienced in a male or female fashion is determined by the person's gender, laterality, and hormone status. People with ALS or MS who have difficulties balancing often also live in fear of falling, and the same holds true for epileptics. The conflict also relates to seeing someone else fall or collapse, for example when you witness somebody having a stroke or a heart attack, or hearing that a loved one has dropped dead. In a transposed sense, the conflict could be experienced as a fall from grace or as feeling dumb, let's say after a separation, from a good job, from society and friends, or from a competition. And one can feel that one has lost his or her balance, direction in life, feels confused, scared, and panicked. In TCM, as we have seen, the vertigo is a result of imbalances in the meridians due to excess or deficiency in Qi energy, the yin-yang, the essence of Jing, or dampness, wind, fire, cold, and heat, all attacking different organs such as the liver and the gallbladder, the kidneys, and the spleen. Vertigo is thus and it's not directly treated. In TCM, the therapy, as we've seen, is based on balancing and re-establishing the harmony in the meridians and the related organs such as the kidneys, the spleen, the liver, etc. And as we have seen, there are many different herbal and homeopathic remedies which must be, of course, customized. So don't self-medicate, always first get a consultation from your trusted healthcare practitioner and get everything set up for your particular symptoms and condition so that you get the desired outcomes. If you have any questions about any of the subjects, do not hesitate to contact us. And also, of course, if you enjoyed this presentation, like, share, subscribe, and also hit the notification button. And also, please consider supporting us via a small PayPal donation or by becoming a Patreon. Thank you very much for that. Your support keeps this channel going. And until next time, stay healthy.